and this closure would lead to the second heart sound. Now this A2 and P2 is not heard together, and there are reasons for that. Well, the left ventricle is a bulkier chamber, so it will be able to finish its workload. That means it will be able to give out the stroke volume much faster than what the RV would be able to do. Also, the pressure in the aortic valve is a higher pressure than that in the pulmonary artery. So the chances that the aortic valve is going to close earlier is much higher. That's why A2 occurs slightly before P2, and this light is only 30 milliseconds. Let's focus on how we would hear S1 and S2 first. If we hear it at the apex, S1 is going to be the louder sound and S2 is going to be the softer sound. Remember, S1 marks the beginning of the systole and S2 marks the beginning of the diastole. So between S1 and S2 is the time of the systole, and between S2 and the next S1 is the time of the diastole. We all know that systole occupies a lesser time of the cardiac cycle than diastole does.